Good morning, everybody. Welcome to the I See the Difference webinar. Today's webinar is focusing on one of the allied health professions, namely that of podiatry. With me today, we have our guest speaker, a fantastic podiatrist who's based up in Stirling in Scotland. Her name is Emma. Good morning, Emma.
Hello. Morning, everyone.
So you may not be able to see Emma at the moment, but what is going to happen is I am going to be doing a brief overview of the different allied health professions, and then Emma is going to do her presentation, which I've had a sneak peek of and is absolutely brilliant, and I'm sure you will find it very interesting and fascinating. Also today with me, I have a colleague called Tom. So good morning, Tom.
Morning.
So you may not see Tom either at the moment, but Tom's job is the moderator of this webinar. And so that means his role is he will be able to ask, answer, or at least pass on any questions that you might have having watched this presentation. So on your screen, if you are the audience, you'll see an orange button with a white arrow. In that, you are able, if you click that, you'll be able to ask some questions. So any questions that come to mind, type them in. Tom will acknowledge them, and then after Emma's presentation, we will do a bit of a Q&A session. So you're not really here, or hopefully you're here to hear from me, but really you're here to hear from Emma. So I'm going to zip through my presentation just to put everything into context, and then we'll transfer over to Emma. So this campaign is all about trying to tell people about jobs that make a real difference to people's lives, and it is focusing on the different allied health professions. One of the things we're going to investigate is the benefits of becoming an allied health professional, and also then we're going to have Emma's presentation, which has got a fantastic title, The Journey I Never Expected. Who does expect their life journey to work the way it does? So it's going to be really good fun. The whole point of our webinar is to say to young people that actually you have the whole world in your hands in terms of opportunities. We're on this planet for a limited number of years, on average of just over 80. We spend a lot of that time doing other things which you might not consider. So at least 5 years eating, 11 years watching TV. And if you're in school, 1 whole year, that is 365 days, 24 hours a day of being in school, and you spend 1/3 of your life sleeping. However, you also spend 1/3 of your life at work. And the point of today's presentation is to try and help you, the audience, choose a career which is going to be fun, interesting, and rewarding. Because if you're spending 1/3 of your life working, why not make it as enjoyable as possible? They reckon there are about 10 key criteria which will make you happy at work. Now, I am sadly 46 years old, and I've had many jobs in my lifetime. I started off training to be a solicitor, which I'm not a solicitor at the moment, never was, but I did the degree and did the training. And I've worked most of my life in the charity sector, doing educational programs. Some jobs I've loved, some jobs I've hated. But these things up on the screen are really good sort of pointers to what will make you good at work, enjoy your work, and I think the allied health professions definitely hit them all. So I'm not going to go through them all, but things like a good work-life balance, so you're not working every hour under the sun, being able to get on with your colleagues, financial stability is really important. But I would say of all these different things, learning and career development and job security are pretty much high up there on the list. I have worked for charities, working for 3 or 4 years in a charity, and one day the money dries up, and so I've been made redundant. I've had dream jobs where I've been there for 5 years, done really well, said, can I have a bit more responsibility? Can I go for this position? I've been told, no, this is the ceiling. This is the job you're doing. That's it. Having an interesting job. If you're spending 1/3 of your life at work, you want something which is interesting, you want to be able to get on with your colleagues, and you want to be appreciated for what you do. And I really think, I truly believe allied health professionals jobs hit those criteria. Now, a lot of allied health professionals work for the NHS, and the NHS, as we all know, certainly this year is the major employer of people in the United Kingdom. It has been doing obviously fantastic work over, well, ever since it's been created, but certainly over this year. And if you are a student in the classroom, at least one person in your class will be working for the NHS in 5 or 10 years' time. Most of all the employers in the United Kingdom, the NHS is the largest. Over 1.3 million people are employed by the NHS. But it's not just doctors, nurses, and midwives. And this is what we want to try and help you understand. It's about more than that. There are loads and loads, 350 to be precise, different types of careers. So whatever your skills, whatever your interests, the chances are there could be a job for you. One of the key sort of umbrella sectors of the NHS are the allied health professionals. Now, so rather than saying allied health professional continuously and on until I get tongue-tied, I may refer to them as AHPs. So AHPs, they're not doctors, they're not nurses, but they are specialist professionals. So if, for example, I go out jogging, which I certainly should try to do, and I hurt my foot, I might go to the doctor, but the doctor say, this is not my area of expertise. I will refer you to a professional who's much more knowledgeable about that area of the body, the lower limbs, feet and ankles, i.e. a podiatrist. The aim of an allied health professional is exactly the same as a doctor or nurse, is to help people get better and live the best life as possible. Like doctors, like nurses, they have their own caseload of patients. Some people they may see over a short period, some for much longer. Now there are precisely, should I say, it's Monday morning, trying to speak properly. There are 15 different allied health professions. Some of these you may never have heard of before. When I started this role in January, I will freely admit I didn't know many of these. Sort of heard of them, things like paramedics and osteopaths, and but not things like speech and language therapists and therapeutic radiographers. So before we have our guest speaker on, I want to give you a really quick overview of these different allied health professions. So 15 seems a bit confusing. I was confused when I started. So really simply, let's break it down. 4 of the different AHPs can be broken down into professions that use techniques to help others help themselves. So this would include art, music and drama therapy and speech and language therapy. Now, of all the different allied health professions, these ones focus more, these ones can be done by a postgraduate study. So, for example, you don't study art therapy as your main course at university, but if you went and did art or music or drama, then you could do a postgraduate course. And like with speech and language, that's also a postgrad course option. But these therapies in particular are more about helping patients recover from illnesses, also helping patients identify. So if you can imagine a young child who is in pain but unable to communicate where the pain is, a speech or music or art therapist might actually use techniques, almost like counseling techniques, to help bring out work out what is wrong with the person, what is right with the person, and where the pain is. We have the AHPs, which are all to do with mobility and help people stay and remain independent if they have a long-term, short-term illness or have suffered an injury. So dietitians are a wee bit like a nutritionist, but dietitians normally work in healthcare settings and hospitals to make sure that people before, during and after operations and illnesses are putting the right type of food in their body to help their body be as healthy as possible, and their brain, of course. A lot of people are becoming more and more identifying with more and more allergies, such as gluten-free or peanut allergies or having celiac disease. And so what you put in your body is obviously vitally important. Some people have to lose weight before operations. Some people have to put weight on after and even before operations as well. Occupational therapists, they deal with people who've had injuries or illnesses, and they are helping them to come up with solutions. So it's a very creative thinking, problem-solving type of career to help their patients regain the lifestyle that they wanted or to get as close as they could. So it's not just people who've been ill and or need to go back to work, but they need to have different type of work equipment. It could be from simple things such as people who have suffered a stroke, and are no longer able to grip things properly, to come up with ideas of how to redesign their household, having stair lifts or baths which are easy to enter, or non-shakeable cups of tea, cutlery which is useful for them. They may have to go into your workplace if you're recovering from an illness and help that workplace be modified so you can get back to your place of work. Or if you've had an injury, you can't play your sport anymore, they come up with solutions so you can play your sport. Orthoptists are experts in the eyes, and there's sort of three levels of eye care. You have your sort of high street level optician who will prescribe lenses and contact lenses. But the orthoptists are the eye experts, so they know all about how the eye and the brain work together, and they will correct things like double vision and blurred vision. And if any operations are required, they will write up all the medical notes, and so a specialist eye surgeon will carry them out. A lot of orthoptists will go into schools and carry out checks on young people, students, to make sure that there's no underlying eye conditions with themselves. Then we have the body manipulators, osteopaths and physiotherapists. Now they can work with a whole wide range of people. I certainly would love to see an osteopath because I've got a achingly sore bad back for some reason. So osteopaths are more specialists in the sort of skeletal structure of the human body, where the physiotherapists will be into more of the muscles and the movement. They're both quite similar but also quite separate, and as you can imagine, their work could take them anywhere in the world, from dealing with Joe Public to dealing with professional sports stars. Then we have prosthetics and orthotics, or prosthetists and orthosists. So they are people who look after clients, patients who are missing a limb or need limb support. So a prosthesis is an artificial limb, and an orthosis is a limb or spinal or body support. Obviously, one being you study the same subject, but you focus on one once you've graduated. And last but not least, we have podiatry. We walk on average about 135,000 miles on our feet, and 25% of the bones in the human body reside in the lower feet and ankles. So walking around, being mobile, is the key work of a podiatrist. But that's all I'm going to say, because we have a real life podiatrist joining us in a few minutes. Last but not least in our list of AHPs are those short-term active treatment AHPs. So we would have probably all heard, or at least seen, maybe experienced the treatment of having a paramedic. But also we have operating department practitioners. So they are the people in charge of operations running smoothly, making sure that the patient is the right patient when they're wheeled into the operating theatre. All the equipment is sterile. They do a lot of communication with the other teams within the hospital, the nurses, the doctors, the surgeons, the people administrating the anaesthetic. So normally the last person you see before you fall asleep during an operation will be an operating department practitioner. They'll be there during operation and then after the operation, making sure that you wake up and you're in the right department with the right people. And then we have our radiography department. So if you've ever suffered a broken limb, a broken arm, twisted ankle, that type of thing, and certainly with coronavirus, a lot of people have been having diagnostic radiography. So if there's something wrong with you, they can do a scan of your body, internal scan, using X-ray and CT scanners. And so that will diagnose what the problem is. And last but not least, we have therapeutic radiography. Now, sadly, 1 in 2 of us are expected to develop a form of cancer in our lifetimes, and it's the UK's biggest killer at the moment. I think 570 people a day die of cancer, which is a real shame. But it is the job of therapeutic radiographers to hopefully treat your cancer. You will be wheeled into a machine, and your cancerous cells will be targeted with special types of X-rays and radiation waves. They have a sterling job to do, not only actually operating the machinery, but obviously that type of disease and illness can be very severe, life-threatening and life-ending in some cases. So like a lot of the AHPs, it's not only about how to operate machinery, and it's also the key thing is being able to work with patients. The reason why we're doing all these webinars is there a big shortage in the United Kingdom of allied health professionals, and in particular the ones you can see in purple: orthoptists, prosthetists and orthotists, therapeutic radiographers, and podiatrists. So what the government are doing, they are saying, if you want to go and study these at university, we will give you £5,000 a year free to go and study to become an AHP. The exceptions are the art, drama and music therapists and osteopaths. But the £5,000 a year free is actually made better. Again, the government will give you an additional £1,000, so that's £6,000 if you want to study the professions in orange, which also includes podiatry. When you start off as a newly qualified AHP after 3 years at a university, you go on to, if you work for the NHS, which a lot of AHPs do, you get paid well. You start off in the pay band, lower, of course, and that's the way jobs work. If you haven't been in a job, you start at the bottom and move your way up. But the crucial thing is, without going into all the detail, the crucial thing is this is an occupation, and it doesn't happen in every occupation, and I can freely testify to that, where as you grow into the job and you learn and you develop and you go on training and you become more skillful and confident, that gets recognized and you can progress and you get paid more. So maybe after 10 years, you've almost doubled your salary. Now, you not only combine this with job security and training and working in a fantastic environment, this means that being an AHP is absolutely fantastic in terms of you getting paid more than the average graduate. The employment rates are great, and if you do need to take out a student loan, you can see on the screen there that you wouldn't be paying much back a year until you could really afford it. Crucially, it's course satisfaction which comes up top. 92% of graduates who graduate from an AHP course get a job, which is the highest I think you can get. And you're making a difference. You're seeing people, you're listening to their stories, you're meeting them face to face, and your actions and your skill, your professionalism makes a real difference to their lives. So before we hand over to Emma, you can also, and this is what Emma is going to be focusing on, as an allied health professional, you don't have to work for the NHS. So most people do, but after a few years, you might say, I want to work for myself, set up my own business. So you can work in what is called private practice. Emma will talk to you about her journey with that. But if you do start with the NHS, you get a good starting salary. And as my first slide showed, with the whole world in your hands, being a professional, your skills are completely transferable. You can pretty much work anywhere in the world. So if you want to work in Australia or Canada or even as far away as Ireland, you can do that. Your skills will be recognized internationally. One of our colleagues is a therapeutic radiographer. Since she graduated, she zoomed off to Australia. I think Emma will say some of her friends are working in Canada at the moment. And the brilliant thing is, rather than just doing the same old job every single day, once you find your niche area, you can have a chance to specialize, which is brilliant. So whatever really floats your boat, you can go, that's the area I want to specialize in. I may set up my own business in it, or I may become a tutor. I might write articles. I might become a work on a board of membership, working for the organizations who run podiatry or prosthetics and orthotics, and you become a senior manager of a hospital. What I'm trying to say is the potential is almost unlimited. You're going to get a job, you can choose wherever you want to work. You're going to be working with people, you're going to be helping people. In terms of qualifications, each AHP has different criteria, but you can find that on our website, and they range from 3 Cs at A level all the way up to an A and 2 Bs, depending on the course. Emma will hopefully tell you more about the skills and qualities that are needed, but in general, you need to be interested in people, curious about their conditions and their lifestyle, because that's hopefully going to help you come up with a solution to their illness or problem. And you need to be disciplined and you need to be committed. And some days things are going to be tougher, depending on the profession itself. So maybe being a paramedic, you might see more people dying than you would have expected, but that's you need a certain type of fortitude. Likewise, I mentioned therapeutic radiography. I've had people in my family who've died from cancer. I've had people in my extended family who've recovered from cancer. So their therapeutic radiographers would have seen good stories and sadly sadder stories as well. So I'm going to hand over to Emma in about 1 minute. So on average, to become an AHP, if you're a student thinking about this and going, wow, that sounds great, you would go to university for about 3 years. Well, 3 years, not about. And the courses are a mixture of lectures, studying, going out on placement, shadowing and mentoring people, and also treating your own patients. So the courses can be intense, but by the end of it, as I said, you come out qualified, knowledgeable, raring to go, and hopefully starting a brilliant profession. There are other routes into this, and our website will give details. So it's not necessarily just a 3-year degree. There are postgraduate options available as well. Sometimes they can last for, you can do accelerated programs, which last 2 years. If you've done other previous qualifications, sciencey or medically based, they can be put into consideration. Some courses can last between 4 and 6 years as well. So it's never too late to be a career changer, even if you're as old and haggard as me at the age of 46. Our website is this, iseethedifference.co.uk. You can email us anything as well. Now, that's it all from me. It's a really quick overview. So now to the star of the show, the guest of the morning, over to Emma. So good morning, Emma. Can you hear me?
I can indeed, yes.
Okay, so there is Emma. So what we're going to do now, Emma, is we are going to make you the presenter, which is, there we go. And hopefully our audience can see we can see your screen. So what I'm going to do is I'm going to be quiet and over to you.
Okay, thank you very much for everyone for coming to join me to hear all about the wonders of podiatry. Now, I have entitled this The Journey I Never Expected. And that is because even when I started my podiatry degree, I would never have expected to be where I am today. So I'm going to give you a whistle-stop tour of how I got into podiatry and where it has taken me. So first of all, if my clicker time is going to work, there we go, this is 16-year-old me. And I actually wanted to be an optometrist when I was at school. Now, this is way back in 1997. You might be forgiven for thinking it was the 80s from my incredibly dodgy style that I had back then. I will not say that that was my high point. Just be thankful it isn't my goth photo that I put in. But I was dead set that I wanted to be an optometrist. And to do that, I was going to need quite high grades. We only take 50 people a year in Scotland to train in it. And I sat my standard grades, I did all the, and that's the equivalent of the GCSEs for England. I went for all the sciences, I did biology, physics, chemistry, English, maths, all these things that I knew would get me where I wanted to go. And I aced them. I got A's, it's all good. And then when I hit my highers, I actually ended up with really bad exam nerves, and I didn't get the grades I was expecting to do. And 16-year-old me was in tears when my higher results came in. I called up the university and said, what can I do to get into my optometry degree? And they said, basically, even at resits, we're looking for 5 A's. I thought, that's just not going to happen for me now. You know, it was expected, but I thought, no, I just can't do this. I thought, right, I know I want to help people. I know I want to work in healthcare somewhere. So I started looking at all the other degree options. And I came across this thing called Podiatry. I thought, I wonder what that is. Something to do with feet. And I was actually having bruises treated at the time. And I went and asked my chiropodist, Anne. I said, Anne, what's this podiatry thing? And she said, well, number one, you pronounce it podiatry. And she said, number two, it's the proper name for chiropody. That's an old-fashioned name that we tend not to use too much now. It actually got changed to podiatry quite some time ago. And she offered me some work experience. And I went in and I shadowed her for a full week in her private practice. And it blew my mind. I couldn't believe the range of things that she was doing. I saw her do surgery. I saw her give people orthotics to help with foot pain. I saw her even just use scalpel skills that changed people within minutes. They would come in hobbling in pain and they would go out dancing, literally dancing. They were so happy with their pain relief. And I thought, right, that's the career for me. So I went and resat some of my hires in my 6th year at school. I wanted to get better grades so that I could get into university and become a podiatrist. And I did some more shadowing, and I did some more research into it. And I applied to Glasgow Caledonian University and Queen Margaret University in Edinburgh. And I did actually get accepted into both, which was great. One thing that I really liked at Queen Margaret was when they interviewed me, they said, look, Emma, you don't have the grades to get in just now. Here's what we're going to want you to get when you do your hires. But we think you've got what it takes to become a podiatrist. We like what you've done, all this work experience you've done. Speaking to you, we know that you've got the skills that we want, because it's not just about grades, it's about problem solving, it's about patient care, it's about trying to find outcomes for people in different ways. And based on that, they said, look, we want you on this degree. So if you don't get your exam results, we'll figure out some other access ways to get you in. So as I say, it's not all about those grades. So I went off to Queen Margaret University, or Queen Margaret University College actually, as it was back then, and I started my degree in 1999, and it absolutely blew my mind. We actually started seeing patients from 3 months into the course, patients that were specially selected for our level that we were at and came into special student clinics. I did everything from anatomy of the lower limb and even parts of the upper body as well. We did brain chemistry, we did histology, we had like little slides of skin under the microscope, we cultured things in labs, we learned surgical techniques, injection techniques, analysis of how people were walking. I bet you didn't even know that you can tell about certain medical conditions just from the way that somebody walks. I'm a nightmare if you can hear people watching. I'm sitting in the street going, they've got that, they've got that, they've got this. Absolute nightmare to take me anywhere, because I'm always analysing my surroundings. I just can't switch off from that. But it was just this absolutely amazing experience. And it was whole body medicine, but how it related back to the feet. And I mean, I even get some of my friends now say, actually, I just want to ask you instead of the GP. It's like, if I'm not a GP, like, yeah, but you still know about all these things. Because really, there is so much medicine to it. And so many different core skills that you might never have even thought that you would need. Now, as a university, it was an absolutely amazing time, and I did make friends that I am still friends with today. And yeah, so the friendships that I made at university have stood me through the good times and through the bad. My friends now work not only locally, and some even with me, but I have ones who have gone to North America to work, Australia, Asia, Abu Dhabi, Dubai, France, Spain, Italy, you name it. One even actually toured the world, working as a locum as he toured. So that kept him on a nice round the world trip for a few years as well. So the opportunities really are quite amazing. Now, when I did graduate, I did the very special version of the degree that took a little bit longer, which is also known as when your exam phobia kicks back in and you have a massive freak out in your final clinical exam and go, yeah, and run crying out the room. But I say it did actually make me a better podiatrist. I went and got hypnotherapy, which really helped with my exam nerves, and I actually graduated 4 marks off of a first class honours. So my university degree was a lot of coursework as well as the exam marks, unlike my stuff at school, which had just been exams. So I found that a really good way for me to learn as well, because it wasn't all based on my exams. But so yeah, I worked really hard at university, and I worked with my therapist as well to get over my exam nerves. And when I qualified, I sold that. You know, yes, okay, I had failed a year of my degree. Did not matter, because I had a year's more experience than everybody else in that room that was being interviewed for things, and I was just going to cost the same amount to them. And because of that, I had 4 job offers before I had even graduated. I only had a projected grade at that time, and I actually chose to enter into the private sector. Now, I had some NHS job offers as well, and I will say for my graduating class, which had about 32 people in it, so we're quite a small knit podiatry classes, every single one of them had a job offer before they even knew what their graduating degree would be. I mean, they all knew that they were expected to pass. Every single one of them was hired before they actually graduated. And I don't think there's many jobs that you can say that in. But I decided to take a job with Boots Foot Care. Now, most of you will be sitting here going, Boots do foot care? And that's because back then there was actually a whole range of healthcare professions that were offered through Boots. And this was an amazing job opportunity. They didn't hire too many people actually, so it was quite a coup to have been offered it. But sadly, the universe had slightly different plans for me, and they got a new CEO who restructured the whole business. And within a few months of me starting with them, the entire division was made redundant. So there was me at 22 years old, having just turned down all these amazing other job offers, and I don't have a job. And I did not know what to do. So I ended up setting up in private practice. I knew one day I had always wanted to run my own business, but I hadn't expected to do quite so soon after leaving university. So I got a grant and a business plan put together, and I was helped by the Prince's Trust, who gave me £5,000 to start up. And within a couple of weeks, actually, of my formal redundancy having come through, I owned 2 clinics. And I had one in Glasgow city centre and one in a rural village in Fife. 2 came up as an option. It wasn't a plan, but that's where we started. And I split my time between both. And I did slowly build them up over the years. And they actually became so busy I couldn't cope. And I had to hire other people to work for me. And now we're a little bit further on now. So now it is 16 years later, and I have a multidisciplinary healthcare clinic in Stirling, which is in central Scotland. I've sold off my other practices, mainly to staff that I have had working for me there, and given them opportunities as well. And today I have 4 amazing podiatrists who work with me, and I have an audiologist who works alongside us as well, and I employ 3 reception staff. In fact, I'm actually coming to you from our clinic today because I am in clinic today treating patients. And we do a huge range of things in here. We do everything from general practice right the way through to minor surgery as well. So we can generally fix pretty much any foot condition that's coming in. And we are solely private. We don't see any NHS patients, although we do work closely with our NHS colleagues to do shared care where it's necessary and to achieve really the ideal patient outcomes. At the end of the day, this is all about patients. It's not about us, it is about them and getting them the care that they need to help with their pain relief and their management. So I just want to take a little moment to tell you basically about these other amazing people that I work with and their career paths as well. Now, on the top left there, the blonde, that is our Katie. And Katie actually is a 2nd degree in podiatry. Her 1st degree was in sports sciences. And she's actually a former professional footballer as well. She has represented Scotland and she spent many years playing in the Scottish Women's Premier League as well. She specialises in musculoskeletal and sports injuries. So she's the person that you come in, like if you've rolled your ankle or if you're having structural problems with your feet, she's the one that you would see in our practice for that because that's her chosen specialty. And on the right of that, we have Danielle. Now, Danielle we actually took in her 2nd year at university, and she started out as a surgical assistant and receptionist with us. And we offered her a job before she qualified as well to come and join us. And that was 4 years ago. She joined us as a podiatrist. And she's actually gone on to get her full master's degree in diabetes since then, studying full time for that. She is quite some woman. Now, she actually fell pregnant during her 1st year of university, didn't even take a break, studied full time with a baby and aced it. And I am always in awe of Danielle and her skills. And then to go on and do her master's degree full time while working as well. I've got a bet going that she'll have a PhD within a few years, but we'll see if I win that one or not. Then on to our bottom line there, we have Zoe. I actually went to university with Zoe and so recruited her for the team as well. She's also got a master's degree, although hers is in pure podiatry, and she's actually had her research published internationally as well. She specialises a bit more in wound care, so, because the amount of lives that one saved through her interventions is off the chart. And then we've got Natalie as well. Now, Natalie's our new graduate, and we have actually poached her again straight from university. She had multiple job offers as she was approaching her qualification, so we felt quite lucky that she chose to come and work with us here. Now, she's still figuring out what she wants to specialise in. She works part-time in the NHS and part-time with us. And she's slowly sort of figuring out as to where she wants to take her career. And at the moment, she's developing a bit of an interest in podiatry services for those who are on the autistic spectrum as well. And because that can be something that can be quite challenging. And we deal with so many different types of patients. And we want to make sure that they're comfortable throughout. And that's one of the things a lot of us here have done extra time and care into is for people who have learning difficulties. or who are on the spectrum or who have dementia or Alzheimer's, to make sure that when they come in, they are safe, they are comfortable, and they feel happy about the treatment that they're having with us as well. So where I didn't expect to be in my podiatry career, I didn't expect to be on the board of directors for my professional body. I was very privileged 4 years ago to be elected by my peers to the College of Podiatry Board of Directors, and I helped set strategic direction for podiatry within the UK. And it's just something that I never really thought that I was going to be doing, but I love every minute of it. I didn't ever actually expect to be offered an admission to the Royal College of Physicians and Surgeons of Glasgow. That's alongside some of the world's most prominent surgeons and doctors, and I got offered a space in the Faculty of Podiatric Medicine for services to podiatry a few years ago. And I do always love that when my mum and dad came to that, and there's people who are like working on the cure for cancer and treating HIV patients in India and all this, my mum went, "So was this quite a big deal then?" "Yeah, mum, yeah, it was. Should we maybe have done something a bit more than getting a Chinese takeout after this?" But you got to love parents that way. But one of the things I did get to treat my mum to was I was invited to Buckingham Palace last year, again as a representative of podiatry. We have the Duchess of Cornwall as our royal patron, and she extended an invite to myself to attend Buckingham Palace with herself and Prince Charles last year, amongst others, and I got to treat my mum, and that was something pretty cool. But if you had asked me, 16-year-old Emma, where do you think you'll be in 20 odd years' time? Buckingham Palace's lawn was not going to be the answer to that question. The other thing that I did not expect to be doing is I didn't actually expect to be the spokesperson for the College of Podiatry either. And for the past 3 years, I have featured in over 200 different publications across the world, actually. We've gone viral a few times. And I speak to all different kinds of magazines, newspapers, websites, anything about feet at all. In fact, I was actually just in the Telegraph at the weekend there. I'm also the resident podiatrist for BBC Scotland, and I do various things for BBC, including the show with Kay Adams. They have a morning show on BBC Radio Scotland, and I'm part of their weekly health surgery expert team. And patients will phone in live with their questions, and I have to answer them all on air to help them with their foot problems. So there's a variety of different campaigns that I do to promote podiatry to the general public, and you've probably already come across me if you've read one of them at some point. You just might not have realised it. Now, the things that I am most proud of in my career, there's sort of 3 big things for me. Number 1 would be on letter, that is my parents, and I actually saved my father's life because of my podiatry training. And a few years ago, he woke up on a family holiday and just wasn't quite right. And within a few hours, he started going quite downhill. And I recognised that these were signs of a neurological issue. There was something wrong with his brain. And he'd actually had a couple of strokes before, including one with me, where I got him treatment. And I rushed him to hospital, and he was very quickly diagnosed with a double-sided brain bleed. He actually had 2 litres of blood had gathered in his brain, and he was not expected to survive the night. He had emergency surgery with a crack team at the Western General in Edinburgh, and they got everything all fixed up, and they described his recovery as miraculous. And they actually said, if your daughter had not got you to hospital, you would never have woken up. You just would have gone to sleep and never come round. And yeah, that was pretty special for me, and that was the training that I had got at university. And I did actually say thank you to all of my clinical lecturers as well, because if they hadn't taught me what they had taught me, if my podiatry degree hadn't given me those skills, my dad wouldn't be here today. So I've been very fortunate over the years. I have had to deal with many clinical emergencies. I have helped patients, when they have been in situations where they've maybe had a cardiac event or a stroke, and that's part of your training. You are trained for it, you stay calm and you know what to do. But when it's your dad, I still did manage to stay calm. My mum said, I didn't think you were serious because you were so calm. But see, that training kicked in, but that's what saved his life. Obviously, the surgeons had a really big part of it, but the timing was key. I'm also very proud of the difference that I have been able to make to people's lives over the years. One of the things I really love about podiatry, and I think where it's a little bit different from many of the healthcare professions, is that we get to see patients on a full journey over many years. some aspects of podiatry, you will only treat them for an injury for a short time, and other aspects, you'll have seen them for many years. And the photo in the middle was taken with a long-term patient of mine, and he actually asked, could I take that photo of you, Emma, because you look so happy when you're treating me. And he had a very painful ingrown toenail. He's a firefighter, and it had bothered him for many years, and eventually did agree to have his surgery that I had been advising for him for about 8 years. And he never regretted having that surgery. He said, you just looked so happy when you got to do it. And it was the satisfaction of knowing what pain relief he was going to get from that. Now, I'm fortunate, as a general practitioner, I have many wonderful relationships with patients. And even one I have treated for 16 years now, who actually gave me a family heirloom when I had my son, because she doesn't have any children. And she said she considers me like a granddaughter and wanted it to continue down the family line. And I will admit, I cried my eyes out when I got that. But we have made a difference in her life. We have helped her with other health professions, referring her on to other specialties when she needed it, because she didn't have anybody to advocate for her. She has no family. And we have been there to help support her in many things other than her feet throughout her healthcare. And she really did appreciate that. So making a difference to people's lives, definitely one of the things I'm very proud of. And my final one is, since becoming a mum, I am very happy to say that I hope I am setting an example for my child. When he grows up, I hope he realises that his mum does something that helps other people, that is a caring profession, and I hope that that will inspire him. My husband is also a health professional, and I hope that he sees how much his parents care about other people and what differences they can make in people's lives, and that he might even follow in our footsteps one day as well. But that's him when he's much younger, doing a little visit to our practice. He's our unofficial mini practitioner. And he's helped quite a few patients with pictures and things over the years as well. But yeah, I hope that the legacy that I'm leaving for him will inspire him one day as well. So really, the big question after this will be, what journey would podiatry take you on? Now, I say it's certainly taken me on quite a wild ride over the past few years, and I've achieved things that I never thought was possible. I'm 38, so I've had my own business for 16 years. That photo that I showed you earlier of my colleagues, not a single one of them is over 40. And in fact, most of them had achieved all that stuff before the age of 30. And I think that's where podiatry really can give you so many opportunities. And I've got people I studied with who have changed the face of healthcare in the world even. You know, they have gone on to areas that they are making a difference in so many lives globally. It is unbelievable. And I think podiatry just offers you so many more options than you might even think of. So really, which section of podiatry do you think will inspire you and where it might take you? And I look very much forward to hearing from you all about where you think it could.
Okay, Emma, that was amazing. Absolutely amazing. You're so inspirational. I wish I had my time again. Right. Okay. Tom, Emma, what we're going to do now, hopefully it may take a few minutes for some questions to come in, but what I'm going to do is ask Tom if there are any questions. Tom, are there any questions?
Not just yet. My computer's just going a little bit slow.
That's okay. Normally what happens is depending on the audience, sometimes they are furiously tapping in there. Just to remind the audience, if you want to ask any questions, what you need to do is there's an orange button with a white arrow on your screen. Anything that Emma said, which is of interest to you, which is probably all of it, then just ask her any questions. She did cover a lot there. Also, there's the opportunity to ask us questions at any time through the website, which I'll show you after this. And what was I going to say? This has been recorded, so you can play back this at your leisure as well. So Emma, we did a talk before this, didn't we? And I told me some interesting tales of and other things. But what do you think the biggest or the biggest misconception of what podiatry is all? Because you sort of opened up my eyes to it, but what do you think the average person thinks what podiatry is?
Well, the usual one I get is, so what do you do for a living? Podiatrist. eh? Like feet. Ah. And I think one of the things that most people think is that feet are disgusting. And you could not be more wrong. Feet are absolutely amazing. So if you think you've got 26 bones in each foot, and then you've got 33 joints and 100 muscles, ligaments, and tendons there. And if you're out in a pair of high heels on cobbles and you're a bit wobbly, you still don't fall over. That's because of your feet. They are these amazing pieces of engineering that keep you up. You know, I don't look at a foot and go, ugh. If somebody maybe comes into me and is struggling and has a lot of problems, I never look at that foot and think, oh, that's disgusting. I look at that foot and go, right, here's a problem. How am I going to fix it? How am I going to make sure that your life is improved from this and stop this from ever happening again to you? And it's about this mindset, you know, that we put on it there. And it just really is such an amazing thing to be able to do. And there's even the other bits that come with it. And sometimes I'll have a patient who's coming in just for their 6-weekly regular treatment. But over a few treatments, I'll notice they're not quite the same anymore. There's little things that are changing. They've forgotten their PIN number. Their shirt wasn't buttoned up right. And we might then do early intervention with the family or the GP who might have been a little bit oblivious to these things because they were too close to it. And sometimes it's us that spots things like there's getting early signs of dementia or Parkinson's. Or even just, we had somebody in 2 weeks ago, I spotted a blemish on their leg. And they're like, it's just a bit itchy, and putting cream on it. And I'm looking at that going, that's skin cancer. I didn't want to tell the patient it was skin cancer. We got them referred, and within 2 weeks of their appointment with us, they had a formal diagnosis of skin cancer, and they had had it cut out. And they got a little message to say, thank you very much, you just saved my life. Didn't really think about that scabby part on the leg, but we're looking at things all the time when people come in. So yeah, I think there's a lot of misconceptions about podiatry, mainly that we just treat little old ladies. We don't. I treat professional footballers, you know, models, you name it, we treat them.
Thank you for that. The thing which is coming across as well, it sounds very much a problem-solving, creative solution type of profession. So can you give any sort of examples of how you've come up with a creative solution to a problem, or just how, in general, how creative and you have to be?
Well, say we do have to get pretty creative at times. A lot of it, there's a lot of detective work and things as well. So I had a patient that kept getting a repeat issue with his foot, and we could not figure out for the life of us why he kept getting this pain on the top of his foot. So we really had to delve down into what he was doing in his daily life. And it turns out he was a very religious man and he prayed frequently. And he hadn't realised when he was praying, the position he put his feet in was actually what was causing this issue. So we came up with a different way that he could do his daily prayers without putting pressure on that area. It was something so simple, but nobody had ever actually taken the time to work that out with them. They had been just, oh, you must be doing this or you must be doing that. And I was going, no. So we really had to delve down into what are you doing every day? And, you know, it took a little bit of time, but then once we realised what it was, we actually gave him a special little pillow to put under the fronts of his legs so his feet didn't hit the floor when he was praying. And it made such a difference to him because we took the time to listen and do the investigation work. So, yeah.
So it's a very, very, very good solution. So if we imagine you're in a school of 100 students, 200 students, entire year group, how would you best sell the profession of podiatry to people who think it's just feet, that's it, I don't like spotty toes, which, because it's not that in any way. So how would you sell it within 30 seconds?
Oh, multiple opportunities. There are so many different aspects that you can tailor it to whatever your special interests are. And you might find new special interests along the way. But it's a career that has so many different options that wherever you wanted to be in the world, wherever you wanted to be as a person, you can do it. You want to run your own business, work part-time, choose your own hours, you can do it. You want the stability of an NHS salary, you can do it. You want a job, you'll get one. You know, it is just such an amazing career, and it can even lead you on to other areas. If you ended up, you wanted to work as one of the other allied health professions, there is even crossovers for that as well. Yeah, opportunity, the one word that would come with podiatry for me.
And you've alluded there that you do a lot of work with other allied health professions as well, other sort of the other categories which I was talking about. So
yes, we work closely with physiotherapists and orthotists for two of them. Again, sometimes with osteopaths as well. Sometimes you'll even be cross-referring over to things like dietetics if you're dealing with somebody who has diabetes or various other long-term health conditions. We're all part of one big family, really, and because we all understand what each other does, we'll often arrange for cross-referrals, really for the benefit of the patient, and they to us if it's felt needed as well. But yeah, I mean, I have a big list of other professions that I regularly would refer a patient on to if I see that they have a need for it. And we can chat that through with patients as well, so we know what to expect and treatment outcomes as well.
Yeah. Now, you may have gleaned during my presentation, I have a sense of bitterness towards some careers where I've done which I didn't progress or didn't have any opportunities to progress in that profession. And that's the complete opposite of allied health professionals. So as a podiatrist, and it sounded like from your introduction of your colleagues, there must be lots of different areas that you can specialize, age groups, types of, not just clinical work, but you mentioned people getting masters and doing lecturing and things. So can you tell us more about that?
Yeah, there's a huge big range of things, really. I have friends who have done postgraduate qualifications purely in podiatry because they chose to further their career. They have become researchers, lecturers, academics. Say one that I went to university with has helped develop diabetes care that has gone on to a global level. She has her PhD as well. We've got another one who did a postgraduate in physiotherapy, and he's actually a podiatrist and a physiotherapist, which makes for a nice combination as well. Others have chosen to specialise in wound care, so diabetes care, sports. There is just so many different things. You can even go on and train in surgery and actually end up doing 4-foot bone surgery as well if you want. So there is just so many different career paths. I have one of my friends from university specialised in learning difficulties as well, and providing podiatry care specifically for people with all different spectrums of issues there. And that can be really, really specialised. She's got some patients who should only be allowed to treat one toe when she sees them because of their complex needs. She used to keep different uniforms in the back of her car and change to different uniforms depending on the colours that would make that person feel comfortable. There's that kind of level of care that you're going into with people. It really is quite tailored.
Brilliant.
I've got a question as well, just around newly qualified podiatrists. So yours is quite a varied role now. You've been in it for many years. What could a newly qualified podiatrist expect in their first year of their working weeks?
Well, I would say within the first year, first of all, you'll have to choose where you're going to work because you'll have a lot of offers. I mean, I've seen 10 job adverts this month alone, so I don't think you're going to be short of opportunities when you graduate. But normally within your first year, you're going to be just finding out about the profession. It's a little bit different in the real world than when you're at university. So many people choose to go into the NHS or a multiple therapist practice at first, where there's other podiatrists they can work alongside and learn from. Just in that newly qualified stage where you're still putting all the bits that you've learned at university into the real world context. But often within a couple of years, somebody has chosen which career path within the profession they want to go down and has started working towards that. I personally just stayed in general practice. I just loved it. So you don't have to choose one little specialist area, but you should expect to be welcomed into the profession, that there is a lot of support there for you as well in all different ways. But we love our new students that are coming. We're there to teach them what we have learned as well, the way that we were taught. So you won't be left out on your own. We are all here for you. We're a lovely, big, friendly podiatry family. A bit crazy, but folk who touch feet generally are. It's not a bad thing. But yeah, you should expect to be welcomed and supported throughout all of that.
And it sounds like it's learning is an ongoing process after university as well, while you're in the profession.
Anybody who works in any healthcare field that tells you they know everything, no, don't believe them. There's no such thing. You're always learning. I learn something new every single week in this job.
That's excellent. It's really good.
Any questions coming in from the audience, Tom?
No, I don't know if we have any technical difficulties. I'm just looking at our question box here.
I like to think it's just my presentation was so good I answered them all.
I think that's the best answer you can have. Generally, what happens, Emma, and I am going to put you on the spot, but please say no to this. If what happens quite a few times is that sometimes these webinars are shown later to classes and things like that as well. And then we get asked questions through our email system, which I'm just going to put on screen. Where is it? So, Emma, if you don't mind, if we get any questions coming in and I can't immediately answer them, would you mind if I forward any questions on to you?
Of course, yeah. And see, again, if anybody's even on social media, you can follow things like the College of Podiatry and the I See the Difference account, where you'll see insights, same with Podiatry Careers one, you'll see insights into real life podiatrists and what they are doing. I personally am Emma the Pod on all handles, and you can see little insights into what I'm doing in my daily life as a podiatrist as well. So there's loads and loads of different ways that you can engage with us even after this webinar, and always be happy to help. And if you are really interested in podiatry, why not contact your local podiatrist and see about some shadowing as well. Even with the pandemic going on, we still do have ways that can happen. Nothing beats seeing us in action in real life, so do approach your local practices, NHS and private, and shadowing is always an option. We'll be absolutely thrilled to have you come in and see about what you do.
I think that is, I know it's uncertain times with the whole pandemic and stuff, but I think you've hit on a good point there. One of the questions we frequently get asked is, I'm interested in this. What can I get an apprenticeship? Can I get a work experience opportunity? So you would say yes to definitely maybe doing some work experience if possible?
Yep, we've actually got one of our patients. She's just started her journey to becoming a podiatrist. She started it a few weeks ago, which we were very chuffed at. We've been treating her for the past few years, and we inspired her to a career in podiatry. And we've already said to her, get your feet under the table at your course, and then can you come in? We'd like to train you up as our surgical assistant. And yeah, hopefully we're going to be supporting her throughout her university career as well, just to help give her some real life experience as she goes. We're absolutely thrilled to be able to offer to do that for her, and she's pretty chuffed about that too, actually.
Oh, that's good, isn't it? The sort of the patient becomes the professor in about 20 years' time.
I'm still friends with my old podiatrist. So.
Yeah. Oh, that's great. That's great. Okay, well, listen, I am going to have to call time on this. As Tom, you weren't here, but when we were doing a practice webinar, I said, Emma, we could have chatted for at least another hour and stuff like that. She is absolutely fascinating and an inspiration. And as I said, I'm gutted I didn't meet you, Emma, 20 years ago. So I think I would have actually really considered being a podiatrist. Hopefully from this, you will have inspired the next generation of podiatrists. Toes crossed, fingers crossed. So all I can say on behalf of the I See the Difference team is thank you so much for your time. I know you're in clinic today. You've got the, it looks like you've got the sort of the uniform on. Is that right? Or
I do. I'm in my scrubs. Yeah.
You're in your scrubs. That's the thing.
My PPE on. I didn't think you'd want to see me looking like a stormtrooper today. You wouldn't hear a thing I was saying on this.
No, it's good. We are so grateful that you've been able to spare the time to do this today. Thank you so much. So, audience, we're going to leave it there. Tom, thank you very much for moderating today. It was your first moderating experience. You've listened to I've been doing this now for 10 months, and Emma, that was by far one of the best presentations I've been privileged to watch. Thank you so much. Yeah, so end it rather than me to say goodbye to everyone continuously. So Emma, thank you again. Tom, thank you. Thank you very much, audience, and hopefully we'll see some of you for our next presentation later on today. Cheerio from us, and thank you again, everyone. Now to end it somehow. I think you can end this.
Yep, we can end it. Yep.
Okay. Bye-bye.
Bye.
I'll do it.